Hey, hello. This is the Philips monitor, and this monitor monitors the patient's heart rate, respiratory rate, SATs, and it also has the ability to take the patient's blood pressure. And there's one in every patient's room. So the first thing is that, I guess I'll talk about that. They have the cords that are coming out the side of the monitor, and it will say what each one is for the blood pressure, the SATs, and then the EKG. So you want to make sure that these are connected into the monitor and that it's connected. What you are wanting to monitor on a patient is attached to these, and then of course to your patient. Okay. So the first thing you're going to do is you want to go ahead and turn the monitor on by pressing the power button. This monitor defaults to the pediatric profile, and the pediatric profile is considered a child that is 1 year old or 12 months to 8 years old, and then 8 and above is considered an adult, and then infant is considered 1 to 12 months. Okay, so this is the main screen, and as you can see, it defaults to peds. And if you wanted to change it to a different profile, you would press profile. And what you want it to monitor, you would want to press on that. Right now it's on PD EKG, meaning that it's going to monitor the patient's heart rate and respiratory rate, and for a peds patient. But you can change it to infant if that's what you need to do. Or you can go down to adult. You just basically have to use the arrows to navigate. So I'm going to go ahead and come out of that screen. The other thing that you'll notice, which it's not here for some reason, let me go. This does not have a patient's name on it. Every monitor that's hooked up to a patient should have the patient's information in there. Usually the secretary does that, but if you come in and you don't have your patient's information on that, what you need to do is you're on the main screen and you press this arrow right here twice, and you'll see the admit discharge. You're going to press that, and the patient demographics screen comes up. Then you just press on the item that you need to put. So I'll press on the last name. A keyboard comes up, and then you can put that information in, and then you just go down and put the rest of the information in. So I'll come out of there, and this is a touch screen, as you can see. So I'm going to go back to the main screen, and I'm going to show you how to take a blood pressure, because that's what you'll be using this for most often. So on the main screen, you'll see after you hook up your blood pressure cuff to your patient, there is a start-stop button. You want to go ahead and press that start-stop button when you're ready, and it'll take the blood pressure. I'm going to let it try to do it in alarm, because I want to show you how to silence the alarm. This is not hooked up to a patient, so it's going to alarm. Or it should alarm. Okay, we're waiting for it. And it's not doing it. But in a real situation, it would alarm. And then you would just need to press the silence button. So I'm going to go ahead and just press stop. And that's something that you can do too. Like for instance, if you had the cuff on, or you thought you had the cuff on, and you press the start button, and then you want to start over, you can press the start stop. It'll start it and it'll stop it. The other thing I want to show you is the standby feature. If you have a patient who is, well, we use it for several reasons. One is the patient, what it does is that the standby will allow you to turn off the monitor or the screen without erasing the patient data. So you just basically press monitor standby, and it actually turns the screen off, but not the monitor, and it retains the patient information. And this is used most often when patients are being transferred or going to a procedure and then coming back, and that information will still be there. So I'm going to go ahead and press standby to turn it back on. Let me see what else you would need to do. There is the end case. Do I use that one? The end case? No, not really. Okay.
One other thing, when you change a profile and you hit confirm, the screen will go dark and then it will come back again. So it does kind of go dark for a
brief
second,
moment,
and then it comes back up. So don't worry that you disconnected something.
Right, it's just taking in that information. The other thing I wanted to show you is that it's labeled here, but the green is going to be monitoring the heart rate, the white is the respiratory rate, and the blue is going to be the pulse ox, which is not showing here. I think that's it. So I'm going to go ahead and shut the monitor off. Thank you. Is that what you wanted to do?